स्वास्थ्य सेवाओं को नई पहचान और नया आयाम देने के लिए बिग हीलिंग हैंड्स 2.0 कॉन्क्लेव एंड अवार्ड्स का भव्य आयोजन चल रहा है। सीधा रुख करते हैं, तस्वीरें आपको दिखाते हैं।
And 5% for GI related, hepatic related, and cancers are 10%. So if you sum up, out of the 100, 66% of them are non-communicable. Now, out of this 66%, even if you look into the sub-classification of the malignancies, almost 20% of them are somehow related to hyperglycemia and insulin resistance, thereby, augmenting the growth of the tissues, namely, cancer of the liver, pancreas, stomach, adenocarcinoma of the esophagus, endometrial carcinoma, postmenopausal. So somewhere down the line, the non-modifiable 2/3 of the diseases can very well be prevented, right? And the prevention boils down to prevention of glucotoxicity, if you sum up. If you talk of anything, but it is ultimately glucotoxicity. So we have a very big role in modifying our country's future health. So for this, unfortunately, preventive medicine is nobody's baby. You have to understand, lately the national NCD prevention national program has been very active in past 7-8 years. They have done a tremendous job. And now we have this Ayushman Bharat also proactively looking at the integration of national health data. So now things are moving. So we have to educate the parents, and we have to catch, as Dr. Saab mentioned, catch the young generation early in the school time as to tell them the two pillars of great health are lifestyle and the diet. And diet basically shifting from almost 80%, 85% carbs that we are all eating, be it wheat roti, the rice, aloo, chini, all that cold drinks. But the emerging biggest hazard, I feel, is the ultra-processed food, which the younger generation is consuming left and right, not realizing every time they are ordering Zomato and buying chips and drinking sodas. So all of them are combining and causing them a long-term injury, which they are not understanding. I've talked just about this NCDs, but there's a bigger Pandora box which is just opening and is going to be exploding in next few years, is going to be Alzheimer's. We are seeing sporadic cases. We are hearing about Alzheimer's. But I'm telling you, it is going to be an explosive situation just in very few years, because it is the glucotoxicity which is now being blamed, and Alzheimer's is now diabetes type 3. So we have to understand the genesis of Alzheimer's also. So all of them are boiling. And suppose we take a bit of a proactive approach, the risk reduction for new onset diabetes goes down by 58%. The risk reduction of stroke, stroke is down by 40%, just by preventive proactive approach. The risk reduction of hypertension is less by 20%. The risk reduction of the cardiac CV mortality is down by 20%. And the biggest success stories have been the pap smear, which reduces the cervical neoplasm by 35%, and mammography up to CA breast by 40%. So all of these things are very, very objective. They cannot be negated. So it's high time the new generation has to be sensitized, and the present generation, especially the guys who are in 30s, 40s, and 50, that we are onto a road of disaster. It's an expressway to disaster. So glucose has to be handled, and everything will fall in place in next 75 years. I feel so.
So I think sugar is the new poison. That is the message we all are delivering to the community. I think efforts in messaging are not inadequate. All of us at our personal levels, community levels, are trying to raise awareness. But we don't have enough policy muscle. If we build a policy muscle, I think the gateways to preventive would open. Because right now, if you see, hospitals, the supply chain, or the pharma, the profitability is not in prevention, it is in treatment. So unless the policy muscle creates something for preventive, we are still stuck. I think alone messaging may not be good enough. That is my take on to it. So, as you mentioned, I firstly must admit you are so great with numbers. So So the predictions are really bad. You know, as an oncologist, I am telling you a very slow tsunami is heading towards us. On 8th of July, there was a combined report which was released by WHO and ICR, and it says by 2050, 92% of us will be affected by cancer. Maybe not physically, emotionally, financially. And 1 in 5 will get cancer. And unfortunately, the figures for India are very bad. So we really, really need to, you know, fact check and start doing something about it. So ma'am, I will come back to you because now we have a second round of questions. What metrics you feel we should use to gauge the success of these preventive initiatives? You know, a hospital bed admission is a lagging data. We need some leading data collection. So what do you propose or you feel would be a good data to collect for the success assessment?
Yeah, so, you know, he's very good with numbers. Maybe the question should have gone to him. Yeah, but dementia reduces by 45% for prevention. So he missed out on that. The metrics, of course, will translate into your data which you maintain. Unfortunately, in India, this is not being done as it should be. Much of the data in the public hospitals is entered in a very gross form. So cause of death will be cardiac arrest. So all causes of death are cardiac arrest. So generally the death discharge or the death summary is often written by the junior most in the rung, and everybody is dying of cardiac arrest irrespective of the etiology of why he came to the hospital. So it's not easy to get any data. In the private sector, of course, we know we have a dichotomy of the public and the private sector. Data is there, but it will be there with the insurance companies because they are the ones who are maintaining what the patient came in with and what he went out with, etc. Sometimes that's not very accurate. And for example, you could have a person who came with a single seizure, but he'll go out with a diagnosis of epilepsy. But all he had was a single seizure and it was an acute symptomatic seizure. So again, the terminologies are different. I do believe that we do not lack human resources. We're a country where there are a lot of young people, and these young people, many of them have done science as a background. It's very important that, you know, if you put junk in, you're going to get junk out. You know that. Even AI is that. I mean, if you're going to put corrupted reports in, corrupted waveforms in, what is going to come out is going to be corrupted. So we need to have really very pure inputs to get an output. So I think data is there, but not all of it is what it is. And there's a scope for improvement.
Thank you so much, ma'am. So I think there's a buzzer telling us to push the question speed faster. So I'll directly jump to Dr. Arunesh. So what do you feel there should be in our mind when we are defining our health priorities, especially India's top preventive health priorities for the next 10 years?
Yeah, it's a very good question. I think India is we have got 1.4 billion people to look after, which can live in Delhi up to the very, remote areas where, they are hard to reach populations. So all the policy formulation, what we inspire or which we plan over the next 10 years should really be taking care of both. It shouldn't be like population of Delhi should have this. I think that's the way forward. I think it will include, we have been traditionally treatment-friendly policy rather than prevention-friendly policy. So one of the things I would like to look next 10 years that we move our thought process, our policymakers, that prevention comes first. Of course, treatment will always be there, but it should be going together. I think we just heard about the killers, our patient mortality, if you look at non-communicable diseases causes more mortality than the communicable diseases.
देखिए इंडिया डेली 24/7 अब आपकी स्मार्ट टीवी पर। इंडिया डेली मौजूद है सभी डिजिटल प्लेटफॉर्म पर लाइव और लगातार। इंडिया डेली 24/7 हर दिन राष्ट्र को समर्पित।